Welcome everyone to the Osteoporosis Support Group through Element Center. Today we have a very special guest, Dr. Jennifer Hahn, and she is a dual residency trained, board certified clinical pharmacist who specializes in obesity, diabetes, pain, and osteoporosis. She earned her BS in pharmacological chemistry and PharmD from US San Diego, and completed her postgraduate residency training at Tufts Medical Center, an advanced postgraduate residency in training with specialization in ambulatory care at the Veterans Affairs Health System in Los Angeles. After being diagnosed with premenopausal osteoporosis in 2020, she set out to revolutionize the calcium supplement industry by harnessing real food calcium to support stronger bones. So thank you, Jenny, for being here tonight with us, and I'll let you take it away.
Awesome. Thank you. Okay, so let me just share my screen. Okay. Does that look good on everyone's end? Okay, awesome. Yeah, so I'm super excited to be here today. Thank you for that introduction. Um, as you just heard, I have a very personal history with osteoporosis, but I also combine that with my professional expertise as a clinical pharmacist and my knowledge there to co-found Scene Nutrition. And it's a startup that created the first patented calcium chew that's only made from real food ingredients. And so we'll dive into that in the talk. But I do want to say that when we look at bone health, we take a multimodal approach. And so that encompasses exercise, nutrition, food. And if you can't eat enough from your food, then that's where supplements comes in. And so I like to debunk kind of the myths around calcium and how to search for the appropriate supplements specifically related to bone health. So that's what we're going to go over today. Okay, so just laying the foundation, why is calcium important for bone health? Well, calcium is critically important for bone health because 99%, so nearly all of the calcium in our body is stored in our bones and in our teeth. So calcium provides both strength and rigidity to the skeletal structure. And the way that we can intake calcium is primarily from the food or supplements that we take. So I like to think of calcium as the literal building block for bone, right? They are the bulk material, calcium, phosphorus, and protein, which we'll talk about, is the building block that makes up your bone. So if you don't have enough calcium, then you're unable to make healthy and dense bones. Also, bone is dynamic and it's constantly remodeling. So we have two main cells in our bones. Those are the osteoblasts, which build bone, and then osteoclasts, which break down bone. And this process of building and breaking down is constantly going on in our bones. The osteoblasts, which are the bone builders, literally use calcium in order to build bone. So again, if we don't have enough calcium in our system, then they are unable to build bone as well because that balance between building bone and breaking down bone becomes imbalanced. And I think I'm talking to mainly females here, so I did want to highlight the key relationship between calcium or bone health and menopause because there's a distinct relationship. So if you look at this graph, the y-axis is bone mineral density, and then on the x-axis, we see age in years. So the red line is women, the blue line is men, and you'll see that we reach peak bone mass density around the age of 30, and after that, there's a slow decline in bone density. That's natural. But if you look at the woman line, so the one in red, you see that when women hit menopause, there's a steep and rapid decline in bone mineral density. And that's because of the decrease in estrogen. So estrogen, think of it, it's putting on the brakes for the osteoclasts or the cells that break down bone. And so when estrogen is removed or decreased in our system, then the brakes are let off of that dynamic equilibrium that was in play before. And so this decline seen right there in menopause between, at 40 plus 50, that's this period of life where we see the fastest bone loss for women. So it's critically important. On average, women lose up to 10% of their bone density in the first 5 years after menopause. And so that increases the risk of developing osteoporosis and increasing the risk of fractures. And so I'm sure you've seen this before if you found us through the Bone Health and Osteoporosis Foundation. And I don't like these statistics because they're scary, but I do want to say what they are right now. So the current statistics as of today show that 1 in 2 women 50 plus will break a bone in their lifetime due to osteoporosis. For women, the incidence of breaking a bone is greater than that of a heart attack, stroke, and breast cancer combined. When I read this statistic, it kind of blew my mind. Like, that is really significant. And then this last statistic, 24% of hip fracture patients age 50 plus pass away, they die in the year following the fracture. So this is how important it is to take care of our bones. I know I see Karen Davis, you're saying it's crazy. Yeah, it's crazy. These are the statistics right now. And I think I bring this up because there's hope, because we can change these statistics by talking about bone health, by doing the multimodal approach that I mentioned: exercise, nutrition, food, supplements where needed, and medications if that's an option for you. And so the main reason why we can change these statistics around bone health, osteoporosis, and fracture risk is because osteoporosis is both preventable and it's also treatable. So I listed here kind of the things that we would think about to prevent osteoporosis and then also treat osteoporosis. And if you look at both of the columns, they're pretty similar. So we have balanced diet. Are you eating enough calcium, vitamin D, protein, the building blocks for bone? Weight-bearing exercise. I'm sure you're all familiar with this: strength training with weights, impact exercise to really stimulate bone growth, those osteoblasts. Estrogen is FDA approved for osteoporosis prevention, but it's also used in treatment modalities as well. Smoking is a risk factor for decreased bone density, and so that's just recommended across the board with the Bone Health Osteoporosis Foundation and various medical guidelines to not smoke. Limit your alcohol consumption. And then this is a key thing here, is that on the prevention side, we really need to know what your baseline bone density is. And so we're working to hopefully decrease the age where men can get that DEXA screening prior to age 65, and 65 being the age where insurance companies will cover DEXA scans. So we need to know that a lot sooner. But even after you have your baseline and say you have low bone density in the form of osteopenia or osteoporosis, it's important to continuously monitor your bone density because osteoporosis is a chronic condition. You don't improve your bone density and then you don't have osteoporosis anymore. We have to continuously work on our bone health. And so the good news is that about half of osteoporosis related repeat fractures, they can be prevented with appropriate treatment, the treatment that I just highlighted here. And so obviously we're going to really just dive into the food aspect of bone health, like what can we eat to really support our bones, and more specifically calcium. So in general, how do we get our calcium, right? There's two buckets: food or supplements. Based on population health data, the average daily intake for American women is about 482 milligrams of calcium. This is a little bit outdated and probably an overestimate of what we're actually consuming, because recent trends show that in general, we're eating less dairy and we're also eating less processed foods, which are fortified with synthetic calcium. And so 842, when I first saw that, I thought that was pretty high because when I did my calcium intake and looked at how much I'm consuming, I was far less than that before I was diagnosed. And so that's the reason why we have this huge calcium supplement industry, right? So people aren't eating enough calcium in their diet, and so they're reaching for calcium supplements, which is totally appropriate. We have a lot of calcium, synthetic calcium supplements on the market, which we'll talk about. There's different types, there's different forms, and we'll go into that in a few slides here. But before we do that, I want to talk about why dietary calcium or calcium from food is superior to synthetic calcium or calcium from the supplements like calcium carbonate, citrate. This is a really key point. Oh, the lights just went off. 1 second. There we go. Okay, so dietary calcium is superior to synthetic calcium because a lot of reasons, but the main reason is because dietary calcium or calcium from food comes with a whole host of other nutrients that help that calcium be absorbed and then utilized by our body. And because of that reason, it has a higher bioavailability or higher amount that our body can use. And then more than that, there's also a safety benefit when we're consuming our calcium from food. We don't have this risk of possible increased risk of cardiovascular disease or accumulation in soft tissues. The evidence is weak even with synthetic calcium supplements, but that risk is not seen at all with dietary calcium. So that's why probably when you go to your doctor and your physician, they say try to eat all your calcium from food, and this is the reason why. I listed various foundations and medical guidelines and societies here. The leading nutrition and medical organizations, all 100% across the board, recommend to obtain your calcium from food. And so how do we do that? This is a table from the NIH, and it shows exactly, okay, how much calcium do we need to be consuming based off of age? So if you're 19 to 50 years, the recommended amount is 1,000 milligrams. If you're 51 plus, then the recommended amount is 1,200 milligrams. And we see that increase again because of women going through menopause. The requirements for calcium consumption are increased because of that steep decline in bone density. And then on the right-hand side, it's a little bit small, but you could also see this is from the same resource that's listed on the slide there. It's from the NIH calcium fact sheet. It shows foods that have high amounts of calcium, and it shows a varied amounts of foods. So I wanted to just kind of pull out some and highlight a few key things here. Sardines, milk, any kind of milk or dairy source will provide, I say this to my patients, roughly 300 milligrams of calcium per serving. So that's a good way to kind of get a baseline. It might be a little bit more, a little bit less based on how much you're eating, but roughly 300 milligrams of calcium. There are a lot of foods that are fortified with calcium, synthetic calcium. So I did want to highlight this. Orange juice, plant-based milks like almond milk, coconut milk, pea protein milk, they are fortified with synthetic calcium. So most commonly calcium carbonate and sometimes calcium citrate. So they do have high amounts of calcium, but a key thing to note is that it's coming from synthetic calcium, not naturally derived calcium from that food. Tofu is the same thing. So tofu has a high amount of calcium. You'll see firm tofu, half a cup has 250 milligrams of calcium, which is a really good amount, but it's because tofu, it's firmed up using calcium sulfate, which is a synthetic calcium form, to make that food. And so again, tofu is a great source, but keep in mind that it's fortified with synthetic calcium sulfate. Other foods that have high amounts of calcium are think of like your fish that you can eat the bones of. So sardines with bones are extremely high in calcium. Salmon with bones also have a high amount of calcium. And so you could take a look at this list here to kind of maybe draw, oh, this is how much calcium I'm eating in a day or maybe in a week. But I do like to go over examples of what does this actually look like, right? Like, okay, what does 1,000 milligrams look like in a day, or what does 1,200 milligrams look like in a day? And this helps visualize how much you actually have to eat in a day to reach your target. So this is literally a snapshot of the meals that I like to eat. So I'm going to list some things. For breakfast, that's when I like to drink a glass of milk. So one glass of milk has 300 milligrams of dietary calcium. It's a great source because it has all the other nutrients that are needed for bone health. And then this is kind of a hack that I like to share is that I add a cup of cottage cheese to my scrambled eggs. And that gives you 140 milligrams of calcium from the cottage cheese. But you're also getting protein from that cottage cheese as well. And it creates a nice soft texture. So it's a way to incorporate foods that have calcium into the foods that you're already eating for breakfast. And then as a midday snack after breakfast around 11 a.m., 10 a.m., when I'm getting a little hungry, that's when I have my calcium chew, which we'll talk about. That has 500 milligrams of dietary calcium from milk. And then lunchtime, this is just an example. Remember, half a cup of firm tofu has 250 milligrams of dietary, not dietary, synthetic calcium from the calcium sulfate. And so I like to just stir fry that with some teriyaki sauce or something, and that provides a good amount. You could eat other things with it. And then dinner, salmon with the bones, 3 ounces, has nearly 200 milligrams of calcium. And then broccoli is also a great source of calcium. You have to eat a lot of it in order to get high amounts of the calcium, but the calcium present in broccoli is really bioavailable. So this is a snapshot of what a day looks like in order to reach the targets. And you'll be surprised that this total amount is actually 1,400 1,420 milligrams of calcium. And so that's exceeding the 1,200 milligrams. So it's totally doable. Um, my diet did not look like this before I was diagnosed with osteoporosis, though. It was far less. And so there is this calcium calculator available at the International Osteoporosis Foundation website. I linked it at the bottom. If you just search IOF calcium calculator, it'll come up and you can input what you eat based off of the last 7 days. So they like to look at the last 7 days of your diet and then calculate from that how much you're consuming in terms of calcium per day. So when I initially did that, I was consuming far less than the 1,200 milligrams recommended. But after diving into the nutrition, coming up with our calcium chew, I'm able to meet those requirements. These are also interesting sources of calcium that that not a lot of people know about. So I did want to highlight it. Chia seeds, 1 tablespoon, so it's not too much, has 75 milligrams of calcium. So if you're someone who likes to have yogurt in the morning, or make or some sort of pudding or something, you could put a tablespoon of chia seeds and soak them overnight so they kind of bloat up and become gelatinous, and have that in the morning. And that's a good way to consume your calcium. This is another ingredient. It's called basil seeds. Has anyone heard of this before? I mean, you could put it in the chat, but basil seeds are also a great source of calcium. Like, look, 1 tablespoon of basil seeds has 185 milligrams of calcium. And basil seeds are this literally the seeds of a sweet basil plant. It's a food that's really commonly consumed in India and parts of Asia. and it has a good source of calcium. And it tastes similarly to chia seeds, so you can kind of just substitute them out. That's why I list them there. If you're going to soak it in water or in yogurt or milk or something, that's a good way to boost your calcium intake. A note here though, with these seeds, they do bloat when you put it in like a water texture. And so you want to make sure that you are not consuming these seeds just dry, because then there's a risk that they could get stuck in your throat and then bloat up. So make sure that you're soaking them in water, milk, yogurt, and then consuming them. This I already mentioned with the almond milk. I know a lot of people are using almond milk, pea milk, or coconut milk, all those things. They are fortified again with synthetic calcium. They don't have that natural dietary calcium that you would think because they say high sources of calcium. Okay, and so yeah, I do want to talk about the calcium chew that me and my co-founder formulated. We're based out of Ithaca, New York here, with Cornell, and we created this calcium chew that's only made from 4 real food ingredients, so nothing synthetic. And I wanted to make this because of my own problem. I wasn't eating enough calcium from my food, but I didn't want to consume it from synthetic calcium supplements, and so we created this solution. These are the 4 ingredients: organic dates. The calcium in our calcium chew is coming from directly milk minerals, and we also have milk protein. Milk protein enhances calcium absorption, so that's why that's in there. And it also has almonds and vitamin D white button mushrooms. So mushrooms are very interesting for many reasons, but they synthesize vitamin D just like human skin. So when our human skin uh, touches sunlight, we naturally make vitamin D, and that's the same process with mushrooms. And so one chew has 500 milligrams of dietary calcium, but because we're using the whole ingredients from milk, it also has phosphorus, magnesium, potassium, zinc, iron, copper, providing the whole host of nutrients that are needed for bone health. Because we know that calcium by itself is not enough for bone health. We need that whole host and family of other nutrients. So this is kind of a summary slide of what I've been talking about. But again, dietary calcium is superior to synthetic because synthetic supplements, like if you go to CVS, Walmart, Costco, Target, anywhere, and roam the calcium supplement aisle, you'll likely see calcium in silo. So it's isolated calcium rather than in concert with the magnesium, with the phosphorus, the copper, iron, zinc, the vitamin D, maybe vitamin K, all of those things. And so a calcium in silo does not work as well, does not get absorbed as well than calcium present with those other nutrients. Um, we'll talk about the different forms of synthetic calcium in the next slide here. So the most common synthetic calcium forms are calcium carbonate, which I'm sure you've heard of, and calcium citrate. Calcium carbonate is the most common because it is the cheapest form. It's literally derived from rock or chalk, and it's the cheapest form because of that. But it also has the highest amount of elemental calcium. So what that translates to is that you can get a lot of calcium from calcium carbonate without having to take so many pills per day. So that's one reason why people like it. But because it's calcium carbonate, it requires stomach acid to be absorbed well. And because of that, it's not as well, it's not tolerated as well. And so we see the highest amount of stomach side effects with calcium carbonate. So that could be constipation, bloating, flatulence. Some people even have it as extreme with vomiting. And that's why maybe people then resort to calcium citrate, because calcium citrate, you don't need stomach acid in order for it to be absorbed well. You can take it with or without food. But the downside is that calcium citrate has lower elemental calcium per pill. So you have to take more pills per dose in order to reach where you need to be. Down in the fine print, I have listed the other many forms of synthetic calcium, right? We have calcium lactate, calcium gluconate. Those are not practical sources of calcium because they have very, very low elemental calcium per pill. And so you're going to need to consume a lot of that. So that's not really used for calcium supplementation. Calcium hydroxyapatite. Um, in general, research is limited with this specific form of synthetic calcium. And so that's why it's not generally recommended. Um, there's calcium D-glucarate, calcium acetate. There's other forms, coral calcium. Coral calcium is calcium carbonate. But I wanted to highlight out here what you're going to see most commonly when you go to the calcium supplement aisle, so you can kind of differentiate. And so these are the key helper nutrients that are absolutely essential to help calcium move to the bone: magnesium, vitamin D, phosphorus, vitamin K, potassium, zinc, and copper. They all have critical and distinct roles for bone health, but they're all important because they help move calcium from your gut to your blood to your bone, which is where we want the calcium to be. And so I listed on the very right-hand side various foods that have high amounts of the nutrient. And so you can look at this table. I'll share these slides with Justine so she can share them with everyone. So you can look, oh, am I eating a lot of these foods? If not, how can I incorporate some of them so that I'm making sure that I'm getting all the other nutrients that are needed for bone health? And then lastly, but really importantly, protein is really important for bone health too. So we know that bones need both protein and calcium in order to be strong, rigid, and flexible. So this little figure that I made on the side here is a really good depiction of what our bones would look like without protein. If we didn't have protein and we just had the building blocks, calcium, phosphorus, then our bones would be so brittle that they would break very easily. On the bottom, if we didn't have enough calcium, then our bones would be like gumbo, like, or those like balloon things in front of car dealerships. They would be just moving all over the place and have no structure. And so that's why we need both protein and calcium in order to give that rigidity, strength, and structure for bones. And so I wanted to list out here, how do you calculate how much protein you need per day? You multiply your weight in pounds by 0.36, and that gives you roughly how many grams of protein you should be consuming per day. There's like on social media, Facebook, there's a lot of talk about how like eating enough calcium per day is a second full-time job. And I fully relate to that because it's a lot of work. You have to think about how much calcium you're eating per day, how much protein you're eating per day. And so take all of this with a grain of salt. We want your diet to be balanced, right? So focus on consuming enough protein. If you're not eating enough protein one day, maybe focus more on that the next day. But look at your diet on with a bigger picture and on average. Um, so yeah, calcium we know is crucial for bone health. You know that now too. Adequate calcium consumption is one of the many necessary strategies to build strong bones. We talked about the multimodal approach. And then consuming your calcium from food is preferred over synthetic calcium supplements because of all the reasons we talked about, how it needs other nutrients to build strong bones. So I wanted to keep this brief because I wanted to save enough time for question and answer. So I'm happy to take any questions if you have any.
Thank you, Jenny. We have lots of great questions.
Okay.
The first one was about the slides, so thank you for answering that. Do you mind stopping the share so we can see your
Yeah.
face? And I'm going to pin you just so Everyone can see you. Okay, so I'm going to start with the ones about calcium and vitamins, and then if there's time, I'll go into other ones. So one question is, are you concerned about dairy being inflammatory for your body?
Yeah, so I have additional functional medicine training because I really wanted to figure out how do we utilize food most appropriately for our nutrition from a preventative standpoint and even part of treatment plans, right? And so a big component of the functional medicine model is to eliminate inflammatory foods. And one of the foods that they eliminate right off the bat is dairy. But we need to break it down into what part of dairy or what part of milk causes inflammation. And for majority of the population, it's the casein that's found in milk or dairy that can cause inflammation. It's not the whole dairy source itself, or it's the fat that's present in milk. And so that's a key reason why our calcium chews it has we source from milk, but we remove all the fat and the lactose so that you're just left with the minerals of milk, not everything else that could possibly increase inflammation in your system. Because we know calcium or milk is the best form of calcium and the highest concentration of calcium in available for consumption.
So from there, can you take seen if you have a dairy allergy and gluten insensitive?
If you have a dairy allergy, you should not take our chew. So, because we source our calcium from milk, if it's a true dairy allergy, then do not take our chew. If you are gluten sensitive, our chew is gluten free, so that would be fine. And again, if you're lactose intolerant, like myself, nearly all of the lactose is removed, and so it's safe for those with lactose intolerance. If you have a dairy intolerance, which is different from a dairy allergy, then it becomes a very individualized decision and something that you should talk about with your provider.
Um, all right, the big one. Do you try to separate high oxalate foods when you eat your calcium foods? And second to that is I hear a lot about oxalates and how they impact the absorption of calcium. Does this impact the amount of calcium we actually absorb from, say, almond milk or the chews?
Yes, this is a very good question, and a question we get asked a lot. So let me think. So oxalates, right? They're naturally present in foods. They're naturally present in a lot of green leafy vegetables. Unfortunately, they've been labeled as like anti-nutrients because they can decrease the absorption of other minerals or vitamins that you're consuming concomitantly. But in general, when we look at your diet and for the general person, I am not concerned about the oxalates present in one food inhibiting the absorption of calcium that you may be taking at the same time. The main reason is because there is a lot of nuance there. You have to look at what food you're consuming that's providing the oxalates, and then what food you're consuming or supplement you're consuming that has calcium. There's been studies that looked at, for example, the oxalates present in spinach, and then they had those same people take or drink milk. So that's the calcium source. And what they found is that there was actually no decrease in calcium absorption when the oxalates from spinach and the calcium from milk was consumed together. So the Bone Health Surgeon General report actually says that if the calcium is coming from two different food sources, that it doesn't decrease the calcium absorption. However, there's also been other studies that looked at, okay, well, I'm going to eat spinach and that's going to provide the oxalates. And then they looked at synthetic calcium carbonate specifically. And then they did see a decrease in calcium absorption. So that shows that you need to be looking at where is the oxalate coming from? Where is the calcium coming from? Is it from food? Is it from supplements? And really, when it comes down to it, if you're consuming something that has oxalates, but also consuming something that has a lot of calcium, that's probably a win versus trying to figure out, okay, how am I going to separate the oxalates from calcium? And it becomes overwhelming when you think about it that way. And in clinical practice, I haven't seen this impact um, diet except for when people are engaging in extreme fad diets. So if they're changing their diet drastically and really increasing their oxalate consumption and really decreasing their calcium consumption, that's when we see issues. But for the general population, the impact of oxalates to calcium is not something that we focus on.
Great. So do you have published research showing the efficacy of of your chews?
Yeah, we're working on a study right now with Cornell Weill Medical Center. Like I said, we're here in Ithaca, affiliated with Cornell, and so we are performing some studies, but they are not out yet. Our chew has just been on the market for a year, and so we use a lot of the data specifically looking at dairy and calcium because that's essentially what our chews are. It's milk calcium. And so we're using that data to really show that if you're consuming dietary calcium from milk, that's superior to synthetic calcium supplements. But yeah, we hope to have some of that hard data out maybe within a year.
Excellent. I'm excited for that. Okay. So wait, did I finish everything with oxalates? I think I did. Yes. Okay. So I just want to summarize, just make sure. So because you're using milk calcium, that the almonds you have in your supplement, the oxalates in any of that would not be blocking the calcium absorption from the milk, from the calcium from the milk.
Yeah, in theory, that's what it should be, right? Because the sources of the oxalates and the calcium are two different food sources. But if we also zoom out, one chew it's only 10 grams, so it's like the size of my thumb. The amount of almonds in each chew, it's 1 gram of almonds in each chew. So even if the oxalates present in the almonds had maybe some impact on calcium, it would be very, 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 very small.
Yeah, got it. Okay, thank you. All right. How about vitamin K, the big vitamin K? It's been on
Oh,
the
yeah.
Instagram everywhere. And then what about vitamin K1, vitamin K2, do either cause clotting? Sorry, do either cause clotting if have a disorder? Yes. So I guess if there's a disorder, a clotting disorder. Yeah.
Yeah, yeah, I understand. So vitamin K, yeah, it's a hot topic right now, for good reason. But vitamin K, it's important to understand that there's different forms of it. So I like to think of it in buckets. There's vitamin K1, there's vitamin K2, and within vitamin K2, we have MK7 and MK4. I'm sure you've heard of all of these different forms before. Um, and the form that it has been studied in various bone health studies, most of these have been done actually in Japan because they've specifically looked at MK4 more than MK7, but it shows that this form of vitamin K can help move the calcium to your bones. It helps in that pharmacokinetic pathway where you take your calcium, you eat it, right? So it goes to your gut, and then it should go to your blood and then to your bone. Vitamin K helps that pathway along. But I want to highlight that there's different forms. Their MK4 has been studied more, but MK7, which is still part of the K2 pathway, is shown to be more potent. And so now studies are showing that a lot of people are consuming more foods with MK7 or supplements with MK7 because it has higher potency, which means that you don't have to consume as much in the form of pills per day. Um, foods that naturally have vitamin K2 and K7 are a lot of the fermented foods, like natto is a really big one. It's eaten a lot in Japan. It's like a fermented soybean, or other fermented foods naturally have the MK7 form of vitamin K. Obviously, we don't consume a lot of that in the United States, and so if you don't, then it may be a good idea to consider the vitamin K2. Um, the question about the clotting disorder, or if you are on any blood thinners like warfarin, specifically, vitamin K can interact or affect your warfarin and thus impact how thin or thick your blood is. And so that would be another discussion to have really specifically with your provider, because that's when dose becomes very important. So you need to look at the dose of K1 versus the dose of K2, and if that's going to impact your warfarin. And maybe I know some patients, they decide to transition their anticoagulant from warfarin to something else, uh, because of this possible interaction.
Great, thank you. All right, does 20%, 21% elemental calcium mean a tablet of 250 milligrams of calcium citrate will give around 52, if you do the math, 52 grams of calcium? Is that what the elemental calcium means?
Yeah, let me pull out my calculator.
Oh, she did the math, sorry. 250 times 21% is around 52 grams.
52. Okay. Yes.
Thank you.
So the elemental calcium, you're thinking of it correctly. So how for calcium carbonate, it's 40%, calcium citrate, it's 21%. So that's why you have to consume more of the calcium citrate to reach that your target dose, because it has less elemental calcium that your body can use. Because right, when we're looking at synthetic calcium, all the synthetic calciums have to be attached to a salt. Those salts are either carbonate, citrate, lactate, gluconate. And how well it dissociates from that salt will dictate how well or how much your body can use, thus the elemental calcium.
Great.
I hope that makes sense.
It does. I'm always wondering why there's an 8 or yeah. Okay. Should you take more protein if you have sarcopenia?
I mean, it's so what we know is that as we age, um, our bodies cannot form collagen as well, which is a form of protein, which is what really our bones are made out of. So if you're not, we know that we're forming it less, and you're probably consuming less in your diet as you age. So that is a reason why people tend to supplement with protein or with collagen specifically for that reason, because you're not consuming enough in your day-to-day diet. Um, I personally don't supplement with protein or collagen every day, but if I'm like traveling or if I'm really busy and I know that I'm not consuming enough protein, because of those reasons, then that's when I would supplement.
So there are some questions on collagen, and I noticed you had that zinc helps with the collagen absorption. So anyways, from your chart, should we be taking collagen, and what about creatine or creatine, however you want to say
These are such good questions. Oh my goodness.
that?
We're going
I
really in
warned
depth.
you. Okay.
Um,
No.
I'm sorry, what was the first question again?
Oh, collagen.
Okay. Yeah, so my take on that is that so collagen is and we're talking about bone health. There's a lot of reasons why people take collagen, but I'm specifically talking about it in the lens of bone health. Collagen is a form of protein, and our body can naturally make collagen if we feed it the amino acids to make that collagen. And so, because of that logic, that's why I don't like to recommend or me myself take collagen supplements every day, because I'd rather focus on eating that whole food that's going to provide that whole host of amino acids for me to form and make that collagen on my own. But again, there are places where that could be really helpful if you're not eating enough, if you know you're not eating enough, or if you're busy, um, maybe if you're vegan, right? Or if you're vegetarian and not consuming a lot of meat proteins, then that would be a time to think about collagen and maybe protein supplementation.
That leads us to the next question. There's several questions on being vegan and what suggestions do you have?
Yeah, that's a hard one because calcium, like we know, dairy is the highest form of calcium, right? And so if you eliminate that as a food group, you just have to be a lot more mindful about what other foods that you're consuming, and you may have to consume more of them. So if we go back to that NIH table, let me just take a look at it, right? It lists on the bottom a lot of foods that are non-dairy based. So turnip greens, kale, cabbage, broccoli, right? I highlighted. Those all have good amounts of calcium, but you have to just consume more of it. Because, for example, like 1 cup of fresh kale has 90 milligrams of calcium. So just compare that to 1 cup of um, milk, right? So milk has 300 milligrams. So you just have to eat a lot of it to get to that same amount and diversify the sources of where you're getting that calcium from if you are vegan.
I actually teach this course on osteoporosis and exercise internationally.
Yeah.
So tahini has 64 milligrams per tablespoon of calcium.
Oh, I like that.
There's a place in the world with a ton of vegans. So that might help. You can throw in some tahini. All right. So there's a lot. Let's go back. Are you okay with a few minutes on hormones, on estrogen?
Yeah, we could talk about that.
So some people are asking, why is my primary care doctor not suggesting estrogen over the 10 years post-menopause? Or someone said over the age of 79. And someone else said, let me go back. Hormone therapy for people with high lipoprotein A.
Yeah. So there's a lot of discussion these days, right? Because the whole swing in the pendulum in terms of estrogen has swung the other way because of the misinterpretation of the results from the Women's Health Initiative. Um, what we're finding is that you get the most benefit in terms of bone health benefit if you could take estrogen within the first 10 years from menopause. You get the most benefit, but that doesn't mean that you don't get benefit after that period of time. It's just less than within the first 10 years. And so that's why maybe it's not recommended by your provider to start that, maybe because they're thinking, how much benefit are you going to get from it if you have other risk factors for being on estrogen? But that's why right now it's only indicated by the FDA for prevention of osteoporosis because they know that we want to build up your bones as much as possible so that when you do hit menopause and your bones are going to take a hit, that estrogen is on board. There's this fascinating study that looked at postmenopausal women who are on estrogen therapy and consuming high amounts of calcium in their daily diet. They found that calcium in adequate amounts can augment the estrogen from their hormone therapy to provide more bone benefit and bone protection. So that's again why like the two go hand in hand, especially in those first 10 years, but it still has a place even after that.
Great. I think there'll be a lot more information coming soon on estrogen, but we'll get there slowly. Okay, bone broth. How about bone broth and calcium?
Bone broth is great. Bone broth is great for a lot of reasons because actually I think of bone broth more in terms of providing a lot of the collagen that you need in your diet because, you know, so I'm Korean. There's this one soup that we eat a lot postpartum, and it's using bone broth because you're consuming a lot of collagen naturally from food. I don't know if it's really high in calcium, but you're getting a lot of the collagen, which is the building blocks for your bone.
Great. We have some pretty detailed questions. Not sure if you want to get into them, but there was a side question on the hormone therapy with people with high lipoprotein A. Did you mention that or?
No, I think that would be a specific question that I'm happy to talk about offline, maybe one-on-one.
Okay. Yeah, that sounds like a good idea. Um, then there was also the creatine or creatinine. I don't know how.
Oh, yes. Creatine is another one of those um, nutrients that are really being highlighted right now on social media. And again, also for good reason. I just posted about it today on my social media too. So creatine is helpful because it helps you build lean muscle mass. And we know that we need lean muscle mass for bone strength as well. You have bone, you have muscle, both of them need to be strong in order to have bone health strength. And so, again, similar to protein, how we make less of it as we age and we also consume less of it as we age, same thing with creatine, is that we consume less and we probably make less as we age, even more so. And then there's been some studies that looked at the differences between creatine production in men and women produce less. And so that's why a lot of us are consuming creatine in the form of supplement or focusing on it in terms of our diet. Um, and then there's studies coming out, I feel like every day about creatine. There was a recent study about creatine preventing or helping Alzheimer's. So there's uses for creatine far beyond bone health.
Another interesting. It is an amino acid though, right?
Yeah.
Yeah, yeah. So I wonder if it would still be better to take it as a in its complete amino acid panel.
Yeah, I mean that's true. Same with collagen. It's just if you're not consuming enough of that, then that's when supplementation is always a good idea.
Okay, shoot, I wrote this down. There's so many good questions. I don't want to keep you. We have
No.
4 more minutes and then we'll go offline. We'll like stop the recording. Kefir. Does kefir
Ooh.
have vitamin K and the M
Hmm.
and how about calcium? I know it has calcium, but yeah. I'll,
Yeah, definitely calcium, but actually I'm not sure if it has vitamin K, and you're probably asking that because kefir is fermented. Um, but yeah, I'm not sure what form of vitamin K, if it does have it, is it K1, K2? I'm not sure. We'd have to look that up. I
um,
know I was just looking into prunes because there's a lot of information about prunes these days with bone health. Prunes are great. They are very nutritious and they also have vitamin K. I was just looking into what form it was, and it has a lot of vitamin K1. Um, but that doesn't, I mean, the studies show that those that were consuming adequate amounts of prunes per day actually had a positive impact on their bone density. Because the thought is that the nutrients present in prunes increase the osteoblasts and decrease the osteoclasts. So it's really fascinating.
it's really fascinating because usually even with the medication, sometimes both go up. So
Right.
to have something that with just the blasts go up, it's been studied since 2002, these prunes. It's pretty amazing.
I
But and
know.
I never knew the link to K1. So that's okay. But there's maybe quickly, which I think is a really great question, is the timing of calcium. When should you take it? How much at a time? And also if
Mhm.
you're taking any thyroid medication or a medication that doesn't interact well with calcium, and if you could speak to timing.
Yes, that's a really good question. So it's found that your body best absorbs calcium at doses of 500 milligrams or less. So that's why it's recommended you eat like short bursts of calcium throughout the day. and why a lot of the supplements that you'll find on the market should be 500 milligrams or less. Some people like sneak in 650 because of marketing reasons, but we know that your body absorbs 500 milligrams the best. So keep that in mind in terms of timing. Like if you're in that example that I showed, if you're going to eat 500 milligrams of calcium from your food that you're eating for, say, breakfast, then wait a little bit and then have your second dose or burst of calcium a few hours later. So that's what I do with our chew is that I like to have it in between meals because I know that that's when I'm getting a little hungry, but also it's going to maximize my absorption of calcium. And then with the interactions, yes, calcium can have interactions with certain medications, like thyroid medications. If you're on certain antibiotics, like fluoroquinolones or tetracycline antibiotics, calcium can impact the absorption of those medications. And so you want to separate the administration of those.
Now I've heard kind of 2 hours, I've heard 4 hours. Is that just based on your metabolism? Do you have any recommendations? Does it matter?
Yeah, I mean it does matter. So you would probably want to separate um as much as you can, right? We have to think about there's only 12 hours that we're probably awake in a day. So do it as much far away from that medication as you can, with a minimum being tw 2 hours. But if you could do more, then that's better.
Great. Okay, last question because it is 7:15. Lactose. So if you are lactose intolerant, you mentioned you're lactose intolerant, but you still drink a glass of milk. Could you speak to that and
Oh, yes.
matter
Yeah.
if it's whole milk or skim milk? Is there anything, anyways, whatever you recommend, go for it.
Yeah, I know that must have been confusing. I drink lactate. So it's the type of milk that has lactose removed or doesn't have lactose in there. So that's the kind of milk that I drink. Um, and then again, like the chews, nearly all of the lactose is removed, and so I can safely take our chews and not have any stomach side effects that I usually would get when I drink like whole milk or 2% milk, whatever that may be.
And does it affect the calcium, whether you do skim milk or whole milk or?
I think that varies. Again, a lot of the skim milks, or like the reduced fat milks have calcium actually fortified in there because that some of that is removed. And so I always say just flip the milk carton, look at the back, go down to the ingredient section, and if it says calcium carbonate, calcium citrate, then you know that it was fortified with synthetic calcium.
All right. So do you do session, like do you do private sessions online regarding nutrition?
I have been just speaking at various groups like this one. Like I last week I gave an interview for another physical therapist who has her own clinic, and I talked about the same things. How do we navigate supplements when it comes to bone health and specifically a focus on calcium? But yes, I just if someone asks and if people need it, then I'm happy to talk about it because this is really a passion of mine. It's combining, something that's affected my life so dearly, and I get to combine it with my expertise. So if I try to educate as much as possible.
Thank you. And what's the best way to reach you should we go to your website or?
Yeah, you could go to my website. It's scenenutrition.com. And there's a contact page there, or you could email me directly. It's jhan@scenenutrition.com. And that'll be in the slides too.
Excellent. We'll put all that in the follow-up email to everyone. And thank you so much for joining us. And I'm going to stop the recording, but if you want to stay on for a few minutes, you're welcome to. Thank you, everyone.
Thank you. So nice to meet you all.